Hi, everyone. Thank you for joining today. My name is Kelly Constantinides, and I'm a Senior BI Analyst here at PDS. Today's webinar topic is In a World of Web Visualizations, Why Excel? And joining me today is Michelle Perry from PDS.
Thank you, and thank you for all of you for joining us today. I look forward to today's topic. It's pretty exciting. For those of you who are not familiar with Practical Data Solutions, for over 20 years, we've been working with clients to deliver data-driven solutions for healthcare organizations. Our solutions make data actionable and visually appealing, which allows organizations to manage data and information that they need in order to make some good business decisions. And visualization is one of the key things that we offer, and that is part of today's topic.
So far in 2021, we have had a series of webinars each month, and we focused on challenges over the past couple of years, CMS changes, RVU changes. If you missed the prior webinars, you can see them on YouTube. They are available. We are going to turn off our cameras today as we jump into the presentation, and I'm hoping, Michelle, you can just kind of cover quickly some of the challenges, the 2020-2021 CMS changes.
Yeah, we certainly have seen quite a few challenges, 2020, and still sort of continue into 2021. And with COVID and the various CMS changes, like the telehealth reimbursement changes, the RVU and conversion factor modifications, and even some of the E&M coding timing rules. All of those changes and challenges have certainly put a little monkey wrench in all of the data that we use for reporting and changed how we need to report the metrics.
So some of those challenges kind of drove this web visual dashboard that we created that really would have been valuable at the time. So you can see in this dashboard really kind of jumps out at you the challenges in Q2 and Q3 of 2020 where revenue dropped substantially. And we didn't necessarily see that same reduction in expenses right away. So it kind of took a little bit for our the drop in expenses to catch up with our revenue declines. We can also look at this impact by specialty using those interactive slicers to see what specialties it impacted the most. And up in the right-hand corner, we can clearly see those quarters where we were so largely impacted in Q2 and Q3 of last year. And I really like that chart on the bottom left because we can see what our projected 2021 expenses look like compared to prior year 2020. And you'll see, if we just kind of focus on the physician salaries grouping there, you'll see the piece of the pie for 2021 is larger than 2020 because those projected salaries are going to be higher this year. The blues, the 2021 carry through from a color perspective across all the different expense categories there. And then brings us into today's topic is looking at visualizations and understanding visualization software. And we're going to review different visual web analytics options. We're going to discuss some strategies to be successful and review some Excel visualizations. And we're going to talk about how we can bring everything together in kind of a synchronized solution.
So many of you are probably familiar with the Gartner Group Magic Quadrant for Analytics, as you see here on the screen. This organization plots top companies as leaders or challengers like Microsoft, Tableau, MicroStrategy. They also, in the bottom quadrant, categorize visionaries like ThoughtPut and niche players like information builders. Typically, what we see in healthcare organizations are these software companies that people are using for visualizations and analytics. And we're going to look at many of those during today's webinar. I was recently reading an article online, and it was interesting to see the jump in what's being predicted for the analytics market. Markets, one of the organizations predicts a 20% annual growth, which by 2020 would expand the market to about 6.5 billion. So certainly it appears, based on this and what we're seeing in the field, is that data and analytics continues to be critical to all organizations to be successful.
So with all those different tools on the market, everybody wants some version of web visuals. And why? Well, they're state of the art and they look really good. And I think even more importantly, the web visual software is easy to use for end users. It's intuitive, it's interactive. They can get the information quickly that they need. And we have one source of truth and the ability to drill down into the detail from the software. So Michelle, let's go ahead and take a look at visual.
Yeah, so let's look at Power BI, which was when we saw the Gartner Magic Quadrant was one of the leaders. And here's one example of a Power BI, and this is a divisional dashboard or specialty dashboard, where on the top I've got some key financial metrics. I'm also looking at payments per total RVU. And what I like about this chart is it's actually providing some comparisons, not just what's happening, but comparison factors like Medicare and that division average. Another element that this dashboard provides is a nice visualization of the gauges or speedometers, depending on what you want to refer them to as, where you can see the AR aging over 150 days and that denial rate. I can quickly visually see, am I in the red, am I in the green, how am I doing overall? So really provides a nice visual presentation of the data.
On the second page of this Power BI visual, we've broken down some additional KPIs. And here we've added some clear visual indicators that users can focus on, where we can compare to targets or benchmarks, or really whatever the organization, considers to be higher performing results. And we've also added some patient survey results onto this visual.
Let's look at, Kelly, let's look at another visual. This is a provider type visual. A lot has to do around compensation and RVUs. You can see that middle graph there where I can quickly point to a provider and see what those key work RVUs and compensation comparisons. And then even over on the right-hand side, I've got RVUs. I'm comparing, again, budget to actual RVUs. And then adding some goals, or also sort of, especially with providers, makes them maybe more motivated. I want to reach that goal. So that's just another presentation of data. And if we go ahead and look at page 2 of this dashboard, we're again pulling in some of that patient satisfaction data, trends, as well as looking at some scheduling data on the top right. And then at the bottom, you've got some different types of gauges that really allows to quickly highlight some key metrics. And the one visualization on this dashboard that I really like is the E&M coding, where I'm comparing prior year to date to current year to date, and then I can easily look at as well as the department averages as well.
So that was Power BI. So let's take a look at Tableau. Tableau, similar to Power BI, is another leader in the industry. We have similar features in these dashboards. And we can quickly see metrics and trends across the organization on this financial dashboard and look at actual data compared to our budget data. What I like about this dashboard is we have this built where we can quickly identify some providers where we're seeing lower collection rates than expected. We can select those providers and all the other charts update, so we can start to look and see if there's some sort of correlation across the specific division or certain payers, and really what to focus on and what's going on with those providers with that lower collection rate.
Yeah, Kelly, you can certainly see how these two tools, Tableau and Power BI, are certainly one of the leaders and offer a lot of similar capability. Here's another example of a Tableau visualization. This only has 2 visual graphs. However, what makes this dashboard pretty unique and actually a little bit more complex to build is we're actually comparing provider utilization Q1 to Q2, and I can quickly highlight, because the tools are very interactive, and really understand what's occurring with those changes. I don't even have to know who those providers are in that grid. I can just simply select them, and over on the left-hand side, I get their provider names along with some key metrics. And then I can also see how that change in utilization is affecting my RVUs. So again, I can really look and compare data with even just two visualizations, two graphs here with the Tableau tool.
So what makes the visual dashboard so appealing? Using the PDS and Power Analytics toolset, we've built out a sample visualization that kind of shows off the variety of just the different chart styles and visualizations that are available to choose from. So here on the first page, we have some different types of bar charts: vertical, horizontal, clustered, stacked, and those bar charts are still a great way to show trending or comparative data. Our second page shows a combination of the bar with, if we add in a line graph in conjunction with the bar graph, we've got a simple line graph at the bottom, or if we move into an area chart over on the right-hand side.
Some other common types of visualization is that pie chart, and another version of that is what's referred to as a ring chart. So when you want to display a handful of pieces, those are some good visualizations. The word cloud down on the bottom left, the bigger words are obviously the higher the volume, so that's an interesting display. And then that sunburst is sort of two rings together and allows you to pop out different types of data that you nest in. So just another option on different styles of visualizations. If we look further down in the example, we also have some heat maps, which Kelly, we saw earlier. Again, I like to use these rather than a pie chart when I have lots of categories. They're good to display. And then there's the bubble chart where you can display multiple metrics across each other. And then, of course, the histogram, which is a very common visualization. There's a network visualization, which I'm still struggling with how I would use this in a healthcare setting, but it certainly is interesting, certainly appealing, and has some different options within that. And then the last set of visualizations is what's referred to as a KPI. So if you want to highlight a particular performance indicator, and this actually is also showing a trend for the previous 12 rolling months. And then below that, you've got, a box plot that most people are familiar with, and the waterfall visualizations. So you can see you have lots of different options to visualize your data within the web tools. Another trend with the web visualizations is really becoming more graphical, setting backgrounds, more free form. So rather than doing things in boxes, that's some of the newer styles that are available. Here's an example of that style where I'm just highlighting a couple key patient satisfaction scores. And what's really nice, because this is a provider level, so I want to keep my data very simple, is that right in the middle, I've got, what's that overall rating? So it's pretty easy and stands out real nice.
So Michelle, before we move on, I see that overall rating is changing based on, looks like above 90% or below 90% green to red. Can we make that little guy give a thumbs up or a thumbs down depending on that rating?
Yeah, actually the visualizations allow you to change the sort of the picture, and that certainly could be an option if you want to take it to the next level, Kelly.
Very cool.
And then the last example that we have here is really highlights where a full web analytics solution comes into play. So we're blending multiple scheduling data sets together, and all, of course, it's interactive. I can select periods. I can use the visualizations to filter to. And then on that bottom left corner where I have some just general appointment statistics, I can go from this visualization and I can drill into, this particular example is drilling into a cube, which is aggregated, again, more appointment data, but obviously more data points, where now the user can continue to interact with that report. They can also change the report if they want some additional metrics or change the layout of it. And then within that, they can go further into the detail and drill into a detailed report where you could get specific patient appointment information, patient name, appointment ID, things like that. So you can go from a highly visual presentation into an aggregated cube, and then from the cube, you can also get into the detail. So that's where that one source of truth that Kelly spoke about, it really becomes into play.
So we just looked at a lot of variety with web visualizations, explored their functionality. So why isn't everyone doing this today? So let's talk about some of the challenges with web visualization. First of all, there's the licensing involved with the software. There are likely server or hardware costs that are associated. And we also need to consider staff, resources, training that staff to deploy and maintain these web dashboards or web visualizations. If you have current reporting or dashboards that you're looking to migrate into a web environment, we have to think about the costs and time frame associated with those resources to do that. And then regardless of what web visualization tool we use, Michelle, would you speak to the importance of having kind of a good foundation to make that successful?
Yeah, Kelly. So certainly, cost and resources are important, and you need to make sure that you're thinking about those. But what we find the most important is making sure that you have a comprehensive data model, sort of a good foundation. Without that good foundation, that example that you saw where I had visualization, full slice and dice and drill capability may not be feasible. So it is critical that you have a good foundation where you've blended data together and that it will support all of your different reporting needs. And we really feel to help with these challenges, it's important that you have a very well-defined long-term strategy with a focus on resources and budget. That's really critical. So to understand where we're coming from, we have to understand what we have today. And we certainly have a lot of good tools today which can allow us to do different reporting techniques.
Yep, so we have tools that allow us to do trending. We can display data in charts or graphs using these graphics, using visual cues. And what tool am I talking about? Excel, of course. So this particular report here, we can see Excel in the background, but Michelle, this looks like what you showed us earlier.
Yeah, so you certainly can get to the same visualization, graphic design can be achieved in Excel. Kelly, we probably could even maybe change that little guy so he's got his thumbs up and thumbs down on this visualization. So, you can do the same types and styles with Excel. So why would you want to use Excel for visualization? I think the most important thing is that it's available. It's a tool that's available today. Everyone has it on their desktop. It's already installed, and you're used to using it. It's sort of a household name. It's a proven software tool and has been around for many years, and it continues to update probably more often than we want, but they're always making updates, adding new graph styles, things like that. And it's a very powerful tool. And what makes it very powerful is it's easy to use. People are learning it very young. I have a very young nephew that's using it today. So certainly when he becomes part of the business organizations, he's going to have all of the skills. And it's deployment. You can rapidly get results because of the ease and flexibility of the tools. Users can create their own dashboards with really minimal IT or other resources required, so you can get to some fast results. Kelly, do you want to show us some of the things that Excel can do?
Yep, you might remember this dashboard. that we introduced about a year ago when patient care moved quite a bit to phone, telephone, telehealth care. And now a year later, we kind of wanted to bring this back because we think it's still very relevant with the continued acceptance of telehealth. From a provider standpoint, regardless of how we're seeing patients, we still need to make sure we're seeing enough patients. We need to see that our patient satisfaction scores are still in good standing and that we are being reimbursed for these services. So we've kind of added, similar to the web tools that we've been looking at, that selector functionality where we can look at things at an organization level in total or at individual specialty levels by just selecting that drop down, and all of our charts update accordingly. So I have a second dashboard in Excel. This one focuses on general ledger data. This is a P&L. And you'll see up on the right-hand corner, we have a selector that works similar to the last one, where we can look at things in total at the organizational level or by one department at a time. Now, functionality-wise, we use a little bit different functionality within Excel, where we're using slicers and pivot tables here. So we can easily look at our revenues and expenses compared to budget in a graphical form here. I really like the pie chart when we're looking at expense categories because I see the bulk of my, higher dollar expenses there, and the smaller pieces broken out on the side because we still want to keep it, even though those make up less of our total expense pool, we can still keep an eye on what those look like. And then on our bottom charts, we're looking at kind of what our revenue and expense looks like per visit or per RVU value, so we can keep an eye on that. So now I myself still kind of also like a good old-fashioned income statement. So we can still provide some more detail with the total amounts here, and we can leverage Excel sometimes to potentially roll up our smaller account level costs into these expense buckets as well, and show some quick graphs there as well.
Kelly, thanks for sharing those. Those are some insightful visualizations, even with Excel. So just as we saw with the web visualizations, Excel visualizations has a few challenges as well. And some of those challenges are the lack of collaboration. Excel visualizations are not online, so it can be challenging for users to share input amongst users. There's a limitation to how much data you can put into the dashboard, so drilling to detail will be limited. The dashboards are not updated as easily as they are with the online tools. And because there's a significant amount of manual work with those updates, there's a potential for some errors or mistakes with those Excel dashboards. And it certainly is time consuming to make the dashboards, I'll say, visually appealing, but there are some opportunities there as well. So PDS Dash is a dashboarding application that leverages Excel to create dashboards and can help with, a couple of these items. So we say with PDS Dash, you build it one time. And by doing that, we can facilitate easier updates, whether you're generating dashboards on a daily basis or a monthly basis. Once it's built that one time, we can quickly generate again. And then this also helps, because it's more of an automated process, minimize those chances of mistakes. As a PDS customer, you also have access to a library of Excel templates. So we like to think we've done, here's some on the screen that you can see, we like to think we've already done some of that harder work of making it attractive and eye-catching for you with this PDS library of templates that we already have in Excel. And Michelle, in that library, what do we have, 70, 80,000 templates? Not quite, Kelly, but there are definitely just a little over 100 different dashboard examples, and organizations are using them in different ways, whether it's take one piece from one dashboard and another piece. But that certainly helps with that challenge of knowing and making the dashboards more attractive. We've sort of helped you with that process. Another item here at PDS that will help with some of the collaboration and distribution of your Excel dashboards is we offer tools for distribution. The first tool, PDS Distributor, allows dashboards to be emailed or moved to network drives so users can easily access them. And then the other tool is PDS Portal, which is a web portal tool where users can easily access their dashboards with really a click of a button. And both of these tools offers a simple yet comprehensive user security configuration, so users have access only to their dashboards that they should. Some other organizations are utilizing Microsoft SharePoint for their Excel distribution as well. So there's some different options to distribute those dashboards.
Yeah, so if you need something quick, Excel's a great solution. Whether you're creating a full dashboard or a prototype, people know it. Generally, Excel's fairly easy to make changes to, and you can leverage Excel to move to the web. And Michelle, do you want to talk a little bit about that strategy?
Yeah, certainly. So this is where I like to say the tools really work well together. So what you can do is you can use, Excel's mapping and joining capability by taking data from multiple data sources and really creating one spreadsheet, which could be some simplified data model. So now I've got a large spreadsheet where I've joined data or mapped data together, and then I can take that spreadsheet and most, if not all, of the analytics tools, you can use that as a data source to get you to the web visualizations rather quickly. So this process allows for rapid development while you're continuing, or your IT and resources are working on a more comprehensive data model. So you can get some quick wins, quick results by using both tools together. So they work well and complement each other, I'd like to say.
So today we saw how powerful and state-of-the-art visual web analytics can be, and we also saw how Excel can provide very effective results, even though it has limits. And then we find that a lot of organizations use a combined strategy where they use some web analytics and also Excel.
Yeah, here at PDS, we feel that the goal of analytics should be to ensure that the users have the right information in an effective manner. So you want to make sure that you're delivering the right data with the right tool. Everybody for attending, and have a great afternoon.
Thanks, everyone.